Perfect. All right. Welcome to Farrell Hall and the Water Resource Institute's seminar series, Water Connects. Feel free to grab snacks back there and put your name in a little raffle to win WI merch if you like. But so this seminar series, we're looking to highlight research on connections between water and health. I'm Hannah. I work at the Water Resources Institute as the Communications and Event Manager. And today I'm going to introduce Kelsey Gleason, whose talk is Living with Risk, How Water and Environmental Stressors Shape Health in Humanitarian and Low-Income Contexts. Dr. Gleason is an environmental epidemiologist specializing in the intersection of human health, environmental stressors, and humanitarian crisis. With expertise in global health, climate change, and forced displacement, she focuses on addressing health disparities in refugee and low-income communities worldwide. This talk will be about 30 minutes with 15 minutes of Q&A at the end. Please hold your questions and welcome to our remote guests. You can feel free to type any questions in the chat box at any time. And I'll turn it over to you.
Amazing, thank you, Hannah.
Of course, thank you.
And thanks everyone for braving the rain. Like there's a lot of students in here, which I'm so excited. Okay, raise your hand if you're not a student. Okay, welcome. Okay, so most of you have had me in class or have me in class now. So Hannah, are we not doing questions because of the online people?
We typically just hold them towards the end. Okay. But if you'd like, we can take them throughout.
Okay, well, if you guys have a burning question throughout, you can answer it, or you can ask it. So Hannah was kind enough to invite me to give this talk, and at first I was like, Hannah, no, I'm not a water person. And she was like, but I think you are. And I was like, you know what? I am like a little bit of a water person. So I'm actually really excited to be here. I was telling a couple people and my students in class today that I'm just back from the International Humanitarian Studies Association meeting in Istanbul, Turkey. I arrived last night at midnight, so I'm like a little bit extra loopy this morning or this afternoon. So bear with me a little bit, but it was an amazing conference. And I mention it not only just because I'm a little jet lagged, but also because so much of this work really applied to the work that was happening at the conference and work that's happening worldwide. We're living in a really challenging environment with global public health and in public health in general. And I have come back from this conference being inspired and rejuvenated and really excited about all the work that's happening to help answer some of these questions and a lot of questions around water and health and the forward momentum that we're going to be seeing hopefully in the future. All right, so I want to start by giving just a brief overview of water, sanitation, and hygiene. So we call this WASH, and WASH is a critical cornerstone of all public health, right? Not just environmental health, not just water, not just epidemiology, but literally everything in our lives involves WASH. And importantly, WASH and water in general is critical, and it's so important in everything that we do and touch, and it's a universally accepted norm that we have access to safe drinking water. Universal access to safe drinking water is a fundamental need, and it's a human right. And in fact, the UN agrees with this. The UN says that access to safe water and sanitation is a human right that applies in times of peace and in emergencies, right? We all agree and we're like, yes, water is this humanitarian right. Like it's this human right, we all need it, it's so important. But in 2025, 2 billion people, so that's 1 in 4 people, lack access to safe drinking water. And 106 million collect water directly from surface water, right? So this is an exaggerated picture of collecting water from a dirty surface water source, but people drink water from surface areas all the time in low income and complex humanitarian settings, right? So often there's no other choice. And as many of my students know from taking my class and just being in public health in general, there's a lot of complexities around access to water in humanitarian and global health settings, right? People are missing school because they're spending their entire day going to and from access to safe water. It's a really, really challenging issue. Also in 2025, so at the same time as we're having 1 in 4 people worldwide lacking access to safe drinking water, we have this issue of climate change, right? And water is at the center of the climate change issue. We're having issues of increased precipitation. So we think about climate change and water health, and we're like, okay, these huge heavy rain events, these huge cyclone events that are happening, increased frequency, increased duration. But actually, if you look at a graph over time of these changes in water, so changes in precipitation, if you look just at the number, like the actual number of precipitation inches per year worldwide, that's actually remaining relatively stable. The issue is that we're seeing changes in where these increased precipitation events are happening. So areas that have seen a lot of rainfall are now seeing less rainfall. Areas that are typically relying on this rainfall for things like agriculture, crop rotation, et cetera, are now seeing this shift in patterns that are really throwing people for a loop. At the same time, because of this shift in patterns, we have huge drought conditions. And so drought can cause all sorts of issues that we'll talk about later, including contamination of water sources, but also issues to things like crops and livestock. And then again, these extreme weather events. So are we able to predict where they're happening and things are changing? Everything's like the whole game is being shifted right from under our feet relating to water and climate change, right? So everything is kind of turning upside down and we're like trying to get the ball in the net, but the net keeps moving. Us as researchers are really trying to disentangle this whole issue. And we're having progress, but it's also really, really complicated. So like I said, there's a change in precipitation and it's not happening in places that are typically see these precipitation events yearly. So we're seeing this change in where we expect precipitation versus where we don't expect precipitation. And this is affecting people's livelihoods, their ability to grow crops, their ability to put food on the table, and their ability to stay disease-free. Okay, so what does this have to do with global health? What does this have to do with conflict? What does this have to do with humanitarianism? So both flooding and drought can have direct impacts on all sorts of different things, but what I'm going to highlight today is the direct impacts that flooding and drought have on disease, on livelihoods, and on migration. By the way, I took these pictures. Can anyone guess where I took these pictures? Aiden. Ooh, close. Bangladesh. So Bangladesh, over 70% of Bangladesh experiences yearly flooding, right? So flooding is pretty constant in Bangladesh. And they also see a lot of issues with disease in Bangladesh. So water and disease. So how does this happen? How is water related to disease? There's actually 2 different ways in which water can be related to disease. So we have this concentration dilution hypothesis. And this is a really high level overview, but the concentration part is that when we have these drought periods, these periods of low rainfall, we see that the water sources become more and more condensed. And when water sources become more and more condensed, we have these pathogens that end up concentrating in the water sources, and that could end up in direct contamination, right? A usually healthy water source then becomes contaminated because of dilution or the lack thereof. Or after an extreme event, like an extreme heavy rainfall event, after a dry spell, we see this washing of contaminants into otherwise clean drinking water sources, right? So there's this limited groundwater precipitation. We see this here, right? It didn't rain for what, like 3 weeks. And then the first time it rained, there's all this runoff that happens, right? So this happens in global health contexts too, of course. And then the dilution component of it is that when you have floods, the water sources just become contaminated, again, because of this runoff. All right, so then thinking about livelihoods, how is water related to livelihoods in these complex humanitarian crises or these global health settings? We have, on the one hand, drought, which results in crop failure, a strain on food security, right? If people aren't able to grow and harvest their crops, they're not going to be able to have food on their table. And this can result in famine. Can anyone give an example of where this might be happening right now? Matan.
Sub-Saharan Africa.
Sub-Saharan Africa, right? This is a huge issue, huge drought, crop failures, famine. And this can also result, even if you're not a farmer, this is going to impact you because you're not then going to be able to access food the way that you once were able to do that. And then this results also in livestock failures. So livestock failures happen because livestock aren't able to drink any water at all, on the one hand. And then on the other hand, people aren't able to feed their livestock what they would normally be able to feed them. So we see these huge crop failures, these livestock failures. Olivia's sending an image. Kind of curious what that is, Olivia. And then we're also seeing flooding, right? So we have this drought that's resulting in all these failures, but we're also seeing flooding, which can, again, damage crops. We saw that here in Vermont during the flooding of last July and the July before. Livestock can drown, and then of course the damage to infrastructure. So these are people's houses that are being damaged, but they're also the roads, they're the hospitals, they're the clinics. So we see this breakdown of public health infrastructure. We see this breakdown of communal infrastructures, a breakdown of social capital and resilience. All these cascading effects from this water flooding issue. And then what do people do when their livelihoods fail? They migrate, right? So if people who are farmers don't have a way to make a living, if people who are not farmers don't have a way to get to their jobs, or the jobs in their area are just no longer sustainable, people are going to migrate, right? Like we do that to an extent too. If my job became unavailable, I would have to migrate to a new city, to a new place, okay? We migrate all the time. And there's two main types of migrants. There are, I didn't know I had the ability to do that. Okay, so there's two main types of migrants. So I'll talk about general migration in a second, but first I want to touch on pastoralists. So pastoralists are traditional people who migrate with their animal herds yearly. So this is part of their culture, this is a part of the norm, that people migrate to different water sources and they have lands in which their animals graze. So they go from grazing habitat to water source to grazing habitat to water source. This is a very normal and traditional lifestyle. But with climate change and the shifting in water patterns, we're seeing reduced rangeland, right? Rangeland is shrinking, water sources are shrinking, and as a result, people are having to expand their territory. Where once pastoralists had this like traditional territory that they occupied, now they're having to move into new territory. They're having to explore new water sources, explore new land. And that's resulting in conflict, right? So pastoralists, again, it's this cultural phenomenon that's culturally and universally accepted in places that practice pastoralism, but there are rules, right? Pastoralists traditionally go to these certain areas, but when they're starting to expand their area because of water scarcity issues, they end up encroaching on other areas and conflict is resulting. Because there's competition over food for the animals primarily, there's competition over land, and there's competition over water. And people who are pastoralists are often have different cultural norms and they're of different cultural groups than people who are not pastoralists. And these cultural differences result in this conflict. So a classic example of this is the conflict in Darfur, which is traditionally known as the first climate change conflict. And this is because pastoralists started encroaching on traditional farmers' land, and there became a huge conflict fueled by the government, very, very complicated, but the origin is pastoralist and farmer conflict because of climate change. Okay, so then non-traditional migration. Okay, I said I was gonna talk about traditional migration, but I think I really meant I was gonna talk about non-traditional migration. I say non-traditional because it's forced. Okay, so this is just like migration, I need to go to a new job, but it's non-traditional because it is forced because of these water scarcity issue. So we have this failed livelihoods, and then we have reduced income, reduced food security. People say, okay, I need some income. I need a way of making money. I need a way of feeding my family. And so they migrate. And that, of course, can result in conflict. People moving to a new area. Again, competition over food, land, water. Cultural differences that happen when you have this migration. An example of this could be the conflict in Syria. So the conflict in Syria, again, very complicated, and I'm oversimplifying here. So if there's any experts in Middle East conflicts here, please recognize that I'm not an expert, and I'm oversimplifying. But the conflict in Syria, there's a large train of thought that this is actually due to an overexploitation of water resources. So primarily water aquifers that then ran dry, crops failed, people moved from the outskirts of cities into the cities, cultural clashes, lot of conflict in Syria. So this is all to say that when we have these water source issues, when we have these droughts, these flooding, these natural hazard related disasters, we're having people moving places they're not traditionally moving. We're having different cultures interact with cultures they're not normally in contact with. And we're seeing this huge humanitarian issue and this huge conflict that's arising as a result of climate change and water issues. And kids are the ones who are disproportionately being impacted by all of these issues, right? So in terms of WASH diseases, in terms of these water and sanitation diseases, every 2 minutes, again in 2025, a child dies from a water-related disease. So childhood diarrhea is the #2 killer of kids worldwide. And the issue is that it's preventable, it's 100% preventable, right? These kids are not dying from diarrhea. What are they dying from?
Dehydration.
Dehydration, right? And we know how to hydrate people. All we need to do is to provide them with oral rehydration salts, right? It's a relatively easy, quick, and simple, and very cost-effective way to cure diarrhea, but we're not able to reach the populations that we need to be reaching. So 700 children die each day from WASH-related diarrhea. So this is diarrhea related to a breakdown in water and sanitation systems due to flooding, due to drought. We also see that WASH is really related to food and kids. 160 million children suffer from WASH-related malnutrition. So the mechanism here is that a kid becomes malnourished, maybe it's diarrhea, maybe it's another related issue, and then they're more vulnerable to malnutrition because their bodies aren't able to absorb what they need to absorb, because their bodies are rejecting the different types of supplements, or not supplements, what's the word I'm looking for? Jet-lag brain, the different types of nutrients that they need. Okay, and then conflict, right? Kids are so disproportionately impacted by conflict. Every single day, we see that kids are the inadvertent victims of conflict, and this isn't because of direct armed conflict, right? If you've taken my class, which like 95% of you have, you will see in this graph, because I love this. This is actually from the New York Times, and this talks about for every 1 violent death in Congo's war zone, there are 62 non-violent deaths from the conflict. These are all public health related, right? These mostly involve little kids because of breakdown in public health infrastructure, because of breakdown in water systems. Okay, so I am gonna give you just a brief overview of the case in Haiti. So this is actually where I have a research project happening right now, but I'm not gonna talk about that research project right now. I'm going to talk about my very first research project, which was in Haiti right after the 2010 earthquake. So I was there working with colleagues. I was actually a student then. I was there working on a project for disaster resilience in urban slums. And we were walking through the community and I see these kids walking with these jerry cans to go collect water. And I was like, hey, can you show me where you're getting your water from? And they're like, yeah, sure. So they take me to where they're getting their water from. The first thing I see is this concrete building or concrete structure. And in it are different shower heads, right, to take showers, but there's no privacy. So people aren't actually taking showers. They're collecting trash in there. They're washing their dishes in there. And then they lead me to here, which is right behind the shower stalls. And this is where they are collecting their water. You can obviously see there's a ton going on in this picture, right? We see people doing their laundry, people collecting water, you can see cows hanging out, drinking. You can see a ton of trash, right? Trash everywhere. So this is a water source, right? This is where people are getting their water from. And the reason why they're getting their water from here is because they don't have any other choice. And in fact, in humanitarian relief, there's actually a book called the Sphere Standards that we rely on to provide aid to people in humanitarian settings. And what it actually says in there is that in the absence of a clean water source, provide people with dirty water, but a lot of it, right? This is like standard practice, unfortunately, because what can you do? If you don't have access to a clean water source, the only thing that you can do is to collect a dirty water source, but then treat it. So it's really a tricky situation. Even if we are going in and trying to help people, we can't just magically make the water source clean, right? Okay, so that was my first experience in global public health. And I was like, yes, I want to do this, right? I really am super interested in this sort of work. And so then I also got really interested in diarrheal disease, which I throw around diarrhea the word all the time, not only because I have small kids who have lots of diarrhea, but also because I use diarrheal indicators in all of my work, right? And I recognize it's not a term that you guys probably throw out around the dinner table. But I'm interested in diarrhea because, as I mentioned, it's the second leading cause of childhood death worldwide. And because as an environmental epidemiologist, we know that the natural environment may be associated with diarrheal risk, right? We know that when we have extreme deforestation, we see more diarrhea. We know that when we see insults to the environment, we see more diarrhea. And then again, this climate change issue. We know that when we have issues of climate change, we're seeing an increase in both diarrheal disease and in this environmental change of this drought, of this flooding, different environmental water-related changes. So then that leads me to like my overarching research question that I always have in the back of my head is, how does the environment impact diarrheal disease? And what I have sought out to do with colleagues here at the GUND, on the floor up above us and elsewhere on campus, is to leverage machine learning to provide new insights into public health research. So when I first got started in this, machine learning was not a thing, not to date myself, but it was not a thing, right? I learned about what machine learning was like 2 years ago. And even then I'm like, I don't know, this is a little crazy for me. But machine learning is allowing us to actually disentangle all these like very many things that are involved in WASH, that are involved in diarrheal disease, and that are involved in environmental change, right? And we're able to like disentangle all of these different factors and figure out what's the most important. So we used publicly available data to try and leverage machine learning techniques to help answer this question. How do environmental factors influence diarrheal disease? So we pulled data from the DHS program, which no longer exists, from NASA. This is primarily where we're getting our satellite imagery from, and from the Climate Hazard Center, which is where we pulled our precipitation and temperature data. we decided to use publicly available data. This actually started during the pandemic when we couldn't travel. And then we decided to keep using publicly available data because we're interested in how we can leverage machine learning to answer these complex public health issues, because it's cheap, it's relatively easy, and we have the potential to reach large populations that we otherwise wouldn't be able to reach. The idea is to figure out what are the bare minimum sets of criteria, like what are the least number of factors that we need to have a grasp on to be able to recommend public health interventions in the field. Okay, so what we ended up doing was we started with a mini pilot and then we moved into a bigger pilot. So we started with a mini pilot in Bangladesh. And what we ended up doing was trying to predict diarrheal disease at 2 different scales. So at the household level and at the village level. And so what I mean here is that we actually ran 2 different machine learning algorithms. And the first one just focused on individual households. So what features of the algorithm are the most important in predicting if a household reports a case of diarrhea disease? So household level. And then we asked that same question, but at the village level. So we're interested in trying to identify, okay, which features are influencing diarrhea at the village level and which features are influencing diarrhea at the individual level. And we felt like it was important to separate these 2 because of how it would influence public health policy, right? Because how we communicate this public health knowledge is very different if we're trying to help individual houses versus communities. And this is an issue primarily of funding and reach, right? We might, like the prevailing idea here was that we might have a better chance of influencing villages, of being able to reach more villages with the same amount of money than we would be able to reach individual houses and potentially have a bigger impact. Okay, so we use I'm gonna like kind of skim over this because there's a lot of students in the room, which is fantastic, but we use what's called a random forest classifier. So we had a whole bunch of surveys with data. We had over 20,000 surveys in all of Bangladesh. And Ryan Vanderheiden, who is a PhD candidate here and works with the Gund Institute, actually led this work. And he was able to identify the feature importance. So feature importance is kind of like which variables are the most important in not predicting. Ryan would be so mad if he heard me use the word predicting, because features aren't predicting, but which features are the most important in this relationship. Okay, so then he produced these beautiful plots which tell us which direction and magnitude these features come out with. So what direction and magnitude do each of these features have in the relationship with diarrheal disease? So first at the household level, of the top 10 most important features, we see 3 are related to water, right? Precipitation in the prior month, precipitation in the current month, and the distance to lakes and oceans. So how far does the household live from a body of water? At the village level, we saw some similar themes, but we saw that the number 1 most important thing, the number 1 most important feature in the relationship between diarrheal disease at the village level is the distance to a lake or an ocean, right? It's super important, according to our machine learning algorithm, how close you live to a lake or an ocean. And then, of course, we also see there's a ton of other variables related to the environment that come up as important. And interestingly, at the household level, we see these socioeconomic variables coming up as important, right? Like age of the child, education, funding status, etc. And we don't see those feature as much at the village level. And so what this can tell us from a public health perspective is, okay, if we're trying to launch a village level public health intervention, we really need to focus on these environmental factors and making these features less important, primarily distance to these water sources. Okay, and then we were like, let's expand it. That clock's wrong, so I just want to make sure I'm running up on time-ish. Okay, so then we're like, let's expand it. So we're gonna expand the same idea to Southeast Asia and Sub-Saharan Africa. The reason why we selected these regions is because taken together, these regions account for 90% of all deaths related to diarrhea. So we did the same exact thing in these areas. So in Southeast Asia and Sub-Saharan Africa, we have this nexus, the same nexus that I've been talking about of the increasing climate-related disasters. We also have these increasing drought and heavy precipitation events. And these are resulting in both crop failure and in famine all across both Sub-Saharan Africa and South Asia. So we have in these two different regions, we have similar diarrheal disease distribution, but very different environmental and climate related challenges, right? We see one region that's seen an increase in precipitation. We're seeing another region that's seen an increase in drought. So again, we built this data set. We worked with a colleague here at the Gund, Hannah Turner, who is a GIS whiz. I don't know if anyone in the room knows GIS, but Hannah is incredible. And she pulled all of this data for us on tree forest cover loss. And then Mojtaba, who is a postdoctoral researcher here at the Gund, led the machine learning component, and he used all these kind of crazy approaches for feature selection. And we are in the midst of this project right now, so stay tuned for what we find. But we're again hoping to run this analysis on these two different levels to be able to best apply what we learned to real life policy and public health implications. And then I just want to end on a new project that I'm working on conflict, climate, and childhood stunting in Nigeria. So I'm working with colleagues at the University College Dublin and at Arizona State University. I don't know if anyone knows Parker. He was a PhD student in engineering and is now a postdoc at ASU. So with this project, we're looking at this nexus between conflict, climate, and childhood stunting with, again, an emphasis on these water impacts. And we're focusing on Nigeria because unfortunately, Nigeria has high prevalence of all these things. And just to note, stunting is just a word that we use in public health that means low height for age. So if a kid is not at the height that we would expect them to be at given their age. So here we're trying to map this all out, right? We're trying to like disentangle all these relationships. We know that food security or stunting and diarrheal disease are related. The arrow goes both directions because kids who are stunted are more vulnerable to these pathogens that can concentrate in these water sources or that can be flushed into your water source. We also know that kids who have diarrhea can't get enough nourishment, that word I wasn't able to pull out earlier, to actually become well-nourished and grow to their full potential, so they become stunted. And then we know that conflict and diarrheal disease are related. We know that kids are 20 times more likely to die from diarrheal disease during a conflict rather than direct violence. So again, think back to that New York Times infographic I showed you. And we also know that food security or stunting and conflict have this bidirectional relationship too. So we have these inequalities, rising food prices, this pastoralism issue, changes in grazing territory, changes in land, etc., that leads to conflict. But we also know that kids who are living in conflict are independently more likely to be malnourished and therefore stunted, right? So we've got this really complicated dynamic happening here. We call this a DAG, directed acyclical graph. Those of you in epidemiology will know exactly what I'm talking about. I tell you I use these, and I do use them in real life. This is proof, okay? So again, we're in the preliminary steps or stages of this. And what we are doing here is we're trying to figure out, so we have all these different models and we're trying to figure out when we have different types of violence, so these 4 different types of violence, how does this relate to kids being stunted? How does this relate to kids being wasted? And how does this relate to kids being severely wasted? So stunting is just a low growth potential. Wasted is actually when you're acutely malnourished, right? Those are the pictures that you tend to see in conflict zones. So what we're finding preliminarily is that where both food insecurity and conflict meet, conflict is what's actually driving the association. So it's conflict that is being the most impactful in this association with diarrheal disease. We see that these protective benefits of food security, so even if a kid is super food secure, we're still seeing that they have these water-related diseases. So why? We actually kind of just talked about this a little bit in class today. Why is because we have this breakdown of public health infrastructure. We have this breakdown of wash systems. We have these kids being indirect victims of war. And we have kids and their families having increased stress levels. And this results in them being more vulnerable to these public health impacts or outcomes. Yeah, you don't want to. Okay, so the last project that we're doing is we're expanding on this even further to work on a new project in Bangladesh together with Dr. Galford here at the Gund Institute. So we're looking at how land use change land cover land use change in the Brazilian Cerrado impacts children's health outcomes. So when we're seeing a lot of deforestation or land cover land use change, how is that impacting kids' growth and development? How is that impacting their health status? And then add on top of that, these changes in climate. So the changes in precipitation, changes in drought. And we are again going to use remote data. We're going to again use machine learning, and we're building these local partnerships. We're building local partnerships out with the university there so that we can eventually expand our work to do in-person data collection to corroborate our findings. So thank you to all of you, but thank you also to all of the many collaborators, lots of students, lots of other UVM faculty worked on this research. And I hope it wasn't too research heavy. I know there's a lot of students in the room. And I would love to get any thoughts, questions that you might have. You can get more snacks also. Aiden.
Yeah, I had a question about the SHAP value that you were
Yeah,
using.
the SHAP values, yeah.
Yeah, so what is that? And I was wondering what the negative and positive values sort of mean.
Great question. They're not intuitive. So for example, if we look at age of the child, so pink is high and blue is low. So this tells us that kids who are younger, and anything to the right of this line means increased diarrheal disease. So this tells us that kids who are younger, so blue kids, are more likely to have diarrhea disease as compared to high kids. Yeah. So what's the second one? Precipitation prior. So then again, like if you look at this line here, when we have high precipitation, we have increased diarrhea. When we have low precipitation, we have decreased diarrhea.
Oh, that's a cool way of measuring like kind of diarrheal disease. Because I feel like it'd be hard to like categorize how you quantify it.
Yeah. So my issue with like machine learning in general is that I am so used to running models, like using statistics to be like, okay, this variable, this feature has X amount of impact on my outcome. But you can't really do that with machine learning with features. So I find these graphs really helpful to visualize the magnitude and the direction of these relationships. So I agree, they're pretty cool. Yeah.
So based also on this slide, you said that you were like, you can do more with the same funds at the village level, but looking at the top two like causes, the distance to ocean, like an elevation, you can see that a low elevation and a close distance to a lake, which I think is probably related, like that has a really big impact on diarrheal diseases. But you talked about the challenges of like cleaning water sources. So like, what would you do to help?
Yeah, great question. And I would love to take any advice from the crowd. I mean, what I would probably do in the situation of the village level is figure out, okay, where are you getting your water from? Clearly, there's some issue that's happening with you being close to a water source, and is it because you're drinking surface water? If you are drinking surface water, let's figure out some ways to clean that surface water. If you are living really close to an ocean or a lake, that also tells me that you might have access to dug water, like a well, or that there could be water in the ground, is what I'm trying to say. So we could potentially install a well for the community, something like that. So figuring out like, yeah, okay, this is a super important feature, but why is it important? And that's kind of our limitation of using remote data is the next step is we got to go into the communities and talk to people, especially because us as researchers here at the University of Vermont, like, I don't know what's going on in the ground in Bangladesh, right? I need to get into the field or partner with local researchers to get into the field to actually understand the nuance of what's going on. And I think like everyone in this room has heard my example of what happened in Bangladesh and cholera with trying to install tube wells and then inadvertently poisoning people with arsenic. Okay, so same thing. So getting into the community, actually disentangling these relationships is really important. So I don't know, but I'd love to get in the community and find out. Yeah.
I have like a clarifying question for the second like research project you mentioned. What was the one in Nigeria? What are the methods you're using? Also machine learning?
No, we're using more traditional methods with that one because Katrina Dowd, who I'm working with, we're both kind of Luddites, I would say. And so we're using traditional regression.
Okay, cool.
Yeah.
And I have a more curiosity question. I was born in like the Sahara region, so but what are the places you're studying this project?
In the Sahara?
Yes.
Yeah, oh, that would be a great question for Ariani.
Okay.
Who, you know Ariani?
No, I don't.
Yeah. Oh, okay, so Ariani is a postdoc. I didn't put her picture here. Ariani is also from Brazil. Are you involved with the GUND or the water resource?
Oh, I'm an undergrad now, but yeah.
Okay, so you should email me and I would love to put you in touch with Ariani, who's also from the Sahara. So I was just looking at a map with her a couple weeks ago of where we decided to actually focus the work. I think we're gonna look into the border region with Mato Grosso. Where are you from exactly?
I'm from Mato Grosso do Sul, so like the south of the Grosso kind
Yeah.
of. Yeah. Cool.
Amazing. Okay, well, email me because I would love to introduce you to Ariani also because she's great. Yeah. Yeah.
I've been holding my question to give the students a chance. It's super exciting to see so many students here today. Thanks a lot for doing the seminar. Last year at this time, we did a whole series on flooding. And we really staged this series because we wanted to shed some light on people on campus, researchers on campus working on water and health intersections. So your seminar was spot on for that. Thanks. My question is really about our campus climate for collaborations. It was really cool to hear about the collaborations you have here. And I wonder a bit about how you built those over your time here and what you wish for if the university or we here at this institute were to provide some more resources for building collaborations. What might be on your wish list? How did you build them, the ones you have?
Yeah.
And what's on your wish list?
Okay, those of you who know me, I'm not super bashful, so I am a big fan of cold emailing. And that is essentially how, oh shoot, oh no, I was trying to look at the picture slide. I'm trying to think of like who the very first person, I can't like make it bigger.
It's not all that common, for example, that the engineering faculty, it's not uncommon, but
Yeah.
engineering faculty are collaborating with faculty in college and university. You might be one of the few.
Yeah. Okay, I've got it. So I actually started in LCOM. I was an assistant professor in LCOM for a while, and I was involved in Beth Kirkpatrick's group there. And Donna Rizzo is also involved with Beth Kirkpatrick's group. And so I was like, Donna, let's do a project together. And Donna was like, okay, why don't you come pitch my class on using your data set for a class project? And so I did, and that is actually the project that I showed you guys, the machine learning project. And that's how I got involved in them. And then I think it just kind of snowballed from there, where I just then became involved with the Gund Institute as a fellow. And I got a few pilot awards through the Gund. And as part of that, you had to have a requirement was having collaborators across campus. So again, just cold emailing people and being like, hey, I'm Kelsey, you want to hang out? Like, I'll buy you coffee. And I would say like 20% of those emails were answered. And those people I just like really latched onto. I will agree. I think it's rare to have these cross-campus collaborations, particularly with engineering. But those have been my favorite collaborations. So I think in terms of what the WRI could provide, I think it's great that the Gund has a requirement that you collaborate with someone across campus. I think that that's super helpful. Pilot grants, do you guys have those? I think this is awesome. Like, again, when Hannah was like, come talk, and I was like, no, she was like, come talk. I was like, okay. That sort of thing, just like inviting people from across campus is really helpful. I kind of was laughing when you first asked that, because I was just in a meeting earlier and just talking about how we're so insular here in our home departments. And I do feel like I've really leaned into the Gund, and I would love the opportunity to lean into the Water Resource Institute too, to work on those collaborations. But I think it's working. Yeah. Sorry, I'll think about that more though, because I would love to think about that and email you.
Any more questions? All right. So you can join us next time on November 3rd, and that's going to be by Ann Jefferson, and that's Rivers of Plastic, Connecting Local Pollution Dynamics to a Planetary Health Challenge. So very similar, but in a different way. So you can join us then, and thank you, Kelsey.
Thank you.